Today we'll be talking about axillary cording. Axillary cording is a side effect of breast cancer surgery that can include sentinel node biopsy or axillary node dissection. Cording typically happens 2 to 4 weeks after surgery, although sometimes it's even been reported occurring several months after surgery. Earlier studies reported cording would resolve on its own between 3 and 4 months after onset. But for physical therapists like me who've treated cording, we've noted it can sometimes last up to a year or longer if left untreated. Untreated axillary cording can cause problems during radiation therapy, as it can restrict the mobility of your arm, and it can also be painful. What exactly is cording? Well, it will look and feel like tight elastic bands or rope-like structures close to the surface of your skin of your inner arm. In some cases, you will see the cords, but in others, you'll only feel sensations of tightness or pain along the arm. Cording can present as a series of small cords or one large cord running down the arm. It will usually start near the site of any scarring in the underarm area and extend down the inner arm to the inside of the elbow. Sometimes it may even continue all the way down to the wrist or palm, and in rare cases, cording can even extend down the chest wall. Since cording can tend to be painful and tight, it can make it difficult for you to lift your arm any higher than your shoulder or extend the elbow fully. This pain and limited range of motion can affect your daily life and function. Also, as mentioned earlier, it can make radiation therapy difficult, as radiation therapy requires you to have your arm placed overhead in this position. The good news is there's things you can do for yourself if a therapist is not available. The first part of treatment is manual therapy. If you have access to a therapist or practitioner familiar with this condition, they can use gentle and specific techniques to release the cording throughout your arm. Sometimes, when the cord releases, you may even hear a popping sound. Don't panic when that happens. Usually, this doesn't cause pain, and if anything, it often brings instant relief by increasing the range of motion of your arm. A second important part of your plan is to do stretching and flexibility exercises. A third part of the treatment is to do gentle manual lymphatic drainage in the area of the axilla of your armpit. If you can remember back to the video of how to take care of yourself right after surgery, we talked about gently doing lymphatic massage down the arm and doing gentle stroking techniques down the arm and across the chest wall. Doing this again several times during the day or in the shower, focusing specifically on the axilla, which is your armpit, or down the inside of your arm where the cording is, may help reduce the swelling in the affected area and reduce the cording. The last and final part of treatment is using warm compresses in this area here wherever the cording is most tight. Because this area is often numb right after surgery, make sure they're warm compresses and not too hot so you do not burn yourself, especially if you know that your sensation has not returned. Thank you again for your attention and good luck with your treatment.